That's what, we're in it for, is to help each other. I mean, you're literally fighting for your life every day.
There's a lot of good that comes out of something so bad. This is the 1% Heart, a podcast about the millions of people living with congenital heart defects in the U.S. and all over the world. In this episode, we're going to discuss what the process is like for a congenital heart patient waiting for a transplant. Today's guest is Bailey Vincent, a congenital heart patient with Epstein's Anomaly, Wolf-Parkinson-White, and an ASD, who is undergoing advanced therapy evaluation for heart failure. We're going to hear about her journey and her experience so far. Before we get started, here is my quick disclaimer. Nothing said here constitutes medical advice. These are our own opinions and stories. I also need to include a trigger warning here, as we will discuss medical-related problems, trauma, and other associated ailments. Listener discretion is always advised. With that out of the way, Bailey, I know you're incredibly busy, so thank you for taking the time to join me here today.
Yeah, of course. Thank you so much. I'm glad we could get this started. I know we've been talking about it for a hot second, so we're really thankful to be here.
Now, I touched on it briefly in the introduction, but do you mind introducing yourself, explaining your condition and what's been going on lately?
Yeah, absolutely. So my name is Bailey. I am 32, and I was born with Epstein's Anomaly. And Epstein's Anomaly, there's a few things, but it's a malformation of the tricuspid valve. And it's a single ventricle defect as well. And that means it's a little bit more rare. So born with it, and also was born with Wolf-Parkinson-White, which is a arrhythmia disorder, and I would say roughly about the 30 worst or the most severe Epstein's Anomaly patients have Wolf-Parkinson-White. And then also I have an ASD that was partially closed during a surgery in 2008. So got those three going on. The Wolf-Parkinson-White was actually found first with me. My mom had, I had fetal arrhythmias, and then they found the structural issue about 5 days later. So when I was born, I spent about 21 days in the NICU and was able to graduate and go home, and here I am now.
And just for our listeners, when you say ASD, you're talking about the atrial septal defect, the hole
Yes.
between the upper chambers. Is that right?
Yeah, upper chambers. Okay. Yeah, and then ventricles on it. But yes, a hole right in.
And what's been going on lately?
So in August of 2023, I was diagnosed with combined right-sided failure and left-sided failure, diastolic and systolic. And so my care team started talking to me about advanced therapies. And because with my particular defect underneath congenital heart disease, I have mostly all of my stuff is on the right side of the heart, and it's not on the left side. So there are very limited options for right-sided failure. So luckily, there's been some great medications out, but, it's time to start talking to advanced care providers. And when my
So when you say advanced therapies, they're not talking, just to be clear, they're not talking about therapy as we traditionally think about it. They're talking about advanced types of care and what they can do for you now and the process going forward.
Yes. Yeah. So advanced therapies would be more, they want to see you maxed out on medications. They want to see you have all your valves replaced. Everything that you can have done, they want to see that have done, and this is your last, therapies you are seeking. And usually it would include, LVAD type situations or implantable cardiac defibrillators.
So it's a checklist of everything they can possibly do for your specific condition before moving to the actual transplant list.
Yes. Yeah. So they evaluate basically how sick your heart is. And, there are things that they can do. And then there's things that they can't do either. For example, I just had an appointment at Boston Children's. That's my team now. And, we're talking about an implantable cardiac defibrillator. And, my team is having to go back and forth because that advanced therapy might not work for me because my right side of my heart might be too enlarged. And so that's specific to me. But, I have to go and have an evaluation with them to see how sick my heart is and to see if that will help. And so I actually do that in April. So April 10th and 11th. And evaluations, it depends on how sick you are. If you are out of the hospital, they'll do it outpatient over a few days. And then sometimes it's easier to do it inpatient and over a few days. It just kind of depends on your situation and what you need done and what information they need.
So, I mean, you're talking about this test in April. It's the end of January now when we're recording. That seems like a long way away, which on one hand, it's good because it means you're healthy. It's exemplary of the different severities, different levels, whatever the easiest way to say it is, but how you're technically in heart failure or near that point, but it's near the beginning. Am I making sense?
Yeah, absolutely. I'm starting the journey of transplant because I actually have already finished an evaluation actually with Johns Hopkins and Children's National, and I decided not to be listed there for personal reasons. But I was like, all right, here we go. This is I get to see how sick my heart is over a few months, and like you said, it's just kind of like, I am healthy and I am super lucky that it's only my heart sick. um, you know, and
That's one way to say it. It's only my heart.
yeah, I've talked to other people who are like, all right, well, unfortunately, having congenital heart disease, my blood was backed up into my liver for years and years and years, and then now I need a double heart liver transplant or kidneys too.
The secondary effects of having this if you don't stay on top of the condition. And then that brings me back to a question I was trying to squeeze in here. You referenced Boston Children's. So shout out that care team, shout out that hospital. Is it a children's hospital? Is it a pediatric doctor or is it an adult congenital heart specialist?
Yes, so both. They were actually
Good answer.
So it's a with congenital heart disease, or at least with my particular situation, I know everyone else's. They want you to be seen with an adult congenital team, but that adult congenital team can be an adult hospital or a children's hospital. But so they have, it's called BOC, the Boston Adult Congenital Heart and Pulmonary Hypertension. And so we are the only adults who can go to that hospital because it's congenital. And so this was kind of the same when I am a military spouse. And so we've moved around here and there. And, it's always like, oh, well, you can see this doctor at the children's hospital or you can, see him at the adult hospital. But it's always with the same team. And I've noticed that, for example, my first appointment with Boston Children's, I actually had to see them at the adult hospital because they couldn't fit me in at the children's hospital just because of appointment scheduling. But my adult congenital doctor, Dr. Misra, shout out, he's awesome. He has privileges at a few different hospitals in Boston, so he can easily get you seen in. And because adults have adult issues too, and so they have to have partnerships with, adult hospitals as well. And so yeah, it's not fun, but it's really interesting to, I get testing done here and, the appointment's here or it's there. But, yeah, it's interesting because, we were born with this.
Right.
And, pediatric cardiologists, they took care of us. And so now, they figuring out that we need all the help.
And I have some strong opinions I won't get into about how there shouldn't be any separation between pediatric and adult congenital cardiology, but I'm not a doctor. I don't know. You had mentioned, so it sounds like you're having great care now comparatively because the children's side and the adult side are working together.
Yeah.
They have a great care team and they're adult congenital heart specialists.
Yes.
But you also mentioned that, military spouse, you moved around a lot and you had to keep going to different doctors. Now, I know just how hard it was to maintain medical care just when my insurance was switched, and I'd go from, I said this once, and I got a couple shocked faces back at me at some heart convention. I think I had 6 or 7 different cardiologists growing up. How it seems like there was a lot of opportunity for you to be lost to care or struggle to maintain your care. What was that experience like? Does it make you even more impressed by the Boston's team?
Oh, yeah, absolutely. It's so interesting. So, fun fact about the Boston team, they were actually the first hospital to be certified with the Adult Congenital Heart Association. And so yeah, it's complete different. I mean, I've been a patient at a children's hospital that literally had one adult congenital doctor, and that's it. And there was no team. And some of the testing that that doctor was ordering wasn't even correct. And it's just like, wow, And then I've been at another hospital where, and all these are certified. And it's like, oh, well, you have this procedure going on and you need a, did the cath lab tell you need a physical? No. So my procedure's in a week. And now you're telling me I need a physical and you guys can't help me out. Now it's on my own to do this. And so it's just, yeah, I mean, the care with moving around and, you know, experiencing different hospital systems and how they go about their congenital heart patients has been so interesting. When I was born, actually, is pretty interesting. I had the same pediatric cardiologist for 23 years. So long story short, I was born in Columbia, South Carolina, at a smaller hospital, not what could deal with what we had. And so I was life flighted down to the Medical University of South Carolina. And oh gosh, thankfully, there was a Dr. Paul Gillette down there who eventually became the head of cardiology at Baylor. And he was electrophysiologist, and he knew exactly how to take care of me. And so the fellow on the team in 1992 ended up being my cardiologist for 23 years. And so my cardiologist for 23 years, Dr. Schuler, loved that man to death. He was present when I was born and then, had to give me up when I was 23. And it was when I was 23, there wasn't any clear route of, all right, this is where we give you now, or I can still see you. He didn't know. And I didn't know either, but now we know. But
Yeah, the transition to adult care is a huge issue with the system. And
yeah,
that's been thematic in everyone I've spoken to and what I've experienced myself.
yeah. I mean, it just with my complex issue, I've unfortunately, but fortunately, have been in this space of where I need constant care. So I've learned, hey, this is what I need to be with. But like my friend Lexi here in DC, she just found out a few years ago she needs to see an adult congenital heart doctor, and she's got serious issues like us. And so it's just like, all right, this is new territory for us. And it ends up being scary too, because we're all still pretty young. And,
Yeah.
but
Yeah, we're young and we seem healthy. You don't look sick.
yeah, we don't look sick. And that's one thing I kind of laugh at is, people will ask me, oh, well, why are you taking the elevator? Or, oh, oh, you're at the gym or this or that. And I'm like, yeah, because it's heart healthy. Keep it healthy. And so it's and one thing you'll find maybe funny with your experience, I have echoes all the time and this and that. And they're like, oh, well, are you a runner? Because you have naturally low heart rate. I'm like, no, I just have heart issues. And they end up thinking, my bradycardia is something that's actually very healthy. And it's like, they're just trying to, make conversation or be nice. But it's like,
And
no.
and if they don't see a lot of CHD patients when they're doing these tests, the technicians, who are probably very, very smart people who are very good at what they do, but
Yeah.
they will see people who are more acquired heart disease in the traditional path they're in. So seeing a CHD patient, it probably is few and far between. But something that did stick out to me, going through these systems, you said that you first found out about this in 2023, that you're going to have to start this process. Is that right? Mid
Yes.
23? So
Yeah.
you've been going through this for about 2 years now and quite a long runway in front of you. But what is something that's happened? Did something good happen throughout this whole process that you just weren't expecting? If someone was in your shoes starting this path today, what would you be able to say to them from your experience?
Well, I would tell them, first of all, take a deep breath because it's going to be a lot. But another thing is, while I say that, it's also going to be really educational for your health too, because, I, I like to know everything about my heart health, how I can be better, do better. And with the evaluation process, I get to know exactly how my heart is doing. I get to have all these tests done. I get to know, I get to check on other, organs and stuff. And I, have the ability to go, to my cardiologist in Boston and be like, hey, I'm worried about my liver. Can we run some liver panel tests and all this kind of stuff? And, a person outside of this one be able to go to their doctor and be like, hey, can I do this? Can I do that? And, but this is, your whole body is important when you're going through this. And, that's another thing that I would say too, just lots of self-care, be good to yourself.
Both mentally and physically, right?
Yeah, yeah. I mean, because every day is not going to be perfect. You're going to be tired. I had to have a right heart cath done in the beginning of December for my evaluation. And so that's painful, invasive stuff that stinks. You have to take off work, I'm a mother to a 3-year-old, I also have to navigate having a kid too with all this stuff. And it's complicated, but I would say, it's worth it because, if you're at this point, you want to feel better. And that's what the evaluation and the whole process is for, to get you feeling better than what you are.
So the takeaway there is take a deep breath. It's going to be a long process. If you're just starting out, take a deep breath. It's going to be a long process. Take care of yourself mentally and physically. Keep your health as your top priority. And then something you mentioned there, which I really wanted to break into, was balancing time and commitments. And I think we can go right into the example. You recently started a new job and you've been navigating corporate America and raising a child while going through this therapy care plan. Now, congrats on the new job, first of all.
Thank you. Oh man,
But I do want to, how has it been overall navigating corporate America with this condition?
Yeah. So I just started a new position, and let me tell you, I was nervous to even apply because I'm from just the mom standpoint. I was stay-at-home mom getting back into this, and then I have this big invisible disability. And so I was like, let's not be nervous about it. Let's tell them about it. I did a lot of research on the company. The company is very inclusive, disability wise. And, I was just reading a lot of good things. It's like, okay, I'm going to apply. I applied, got in, and, it's starting, I've had a few in-person days, and I don't feel like I have to hide anything. They are so nice and kind about what you're going through. They care about you as an employee. And I I'm glad that I was, like I said, it's invisible. And I was glad I was able to say something about it because I was nervous because, I'm going through this evaluation stage with Boston coming up. I have to take days off. I have to be, you know, um, upfront about what's happening. But, like I take diuretic, as part of my regimen. And I'm like, hey, I might have to like have more breaks because of my medication schedule. And they're like, do whatever you want. Like, that's what you need to do. I was like, great, and I was so thankful. Even that, that's don't even care. And it's like, I get to take care of myself. And they actually have this like employee wellness program too, where they offer you mental health benefits and all this kind of stuff. And just not even, with my disability, just as in being employed too. And so it's been tough because I've already had to take 4 hours of sick time, for this situation, but it's it works. And, I'm very thankful. Corporate America, it was nerve-wracking getting into it, but, I'm adjusting with it and it's adjusting with me. And I'm just so thankful that at least with my company, I feel at home and I'm able to take care of myself first and foremost.
I had this different experience in a similar situation. I'm thinking that if I had been open and transparent, so I worked at a bulge bracket bank back from 2018 to 2020, and I was so worried about how I would be perceived with any kind of physical ailment that I kept my shit on lock. I didn't tell anybody anything ever. And now, and this has popped up a few times, but I've been wondering if I did myself a disservice by not trusting the company or not trusting, at least my direct manager, who is a great person who I've maintained contact with
Yeah.
afterwards, because I'm sure she would have been supportive, but I was so caught up in my head. And what I should have done is exactly what you did. I shouldn't have spoken out, but I should have researched, seen what the company stood for, and gone from there. And if someone's listening to this now, I mean, you have to go into any job interview or any company with both eyes open for a wide variety of factors. But if they seem to be the type of company that's going to support you through the process, then maybe it should be brought up. Maybe you should mention it. You've got to make that judgment call just like you would anything else when you're applying for the company.
Yeah. Oh yeah. I mean, because I wanted this job because I want to take care of myself. I, want to, feel proud about what I'm contributing to society. And, I have to take care of myself a little bit extra. And so, I needed a company who could do that. And so, me personally, I'm just so thankful, and I, I feel you so much because I was that way on should I even tell them, you know? And it's like I'm coming from an employment break as a stay-at-home mom. And then it's like I already have a break in my employment. And then now I have to tell them about a disability. And so I'm just like, okay, well, Bailey, you have to take care of yourself first and foremost. So, how best am I going to be served? And I was like, dumb. So, yeah.
And what's the mix of your job between remote and in person?
Yeah. So, right now I am in training. So when I'm in production, I will be at home besides training things and this and that. But we're doing more of like classroom in person and things like that, just to kind of get us situated with, if we do have to go into the office, this is what it would look like. Or
Gotcha.
if we get pulled out of this job and we have to go into another position where we are full in office, here's your coworkers, here's this, here's that, so it's just a big family too. And so they want to see you and they want you to talk and be friends and everything. And so it's just, it's awesome. And yeah, it's it's really interesting, and they've made it really easy for me and my class to be able to do this thing, the hybrid situation. But yeah, and then the hybrid situation just works out best for me too, and in my disability as well, because this is my office, and if I have to put a pause on work and take care of myself, take my blood pressure, I get to do that, and I don't get work for it. So oh, I couldn't be more blessed and thankful.
That's awesome. That's really great to hear. But
Yeah.
taking a step back from a more holistic approach, I mean, you mentioned you have friends who are also in corporate America and navigating that environment. If you're speaking to a patient today who's just graduating college, what would you tell him or her about how to approach it? In your own words, I think I kind of did a general summary a while ago, but what would you how would you tell them specifically to navigate this?
I would tell them to be honest with themselves and to be honest with their employer, because their employer is there to take care of them. And if you're not seeking a job that doesn't take care of you, then I don't know, I wouldn't seek that job. But just do the right
That's fair. That's fair with the caveat that this is a tight job market, and yeah,
it's full time.
good companies are good companies, but
Yeah,
everyone needs to have both eyes open. Yeah, I'm not going. I've worked for good companies. You're working for a good company, so I'm not saying anything bad about them.
yeah,
But it's also, if it was me, I would tell everyone to be very cautious about what they share, which might be the wrong takeaway and it might be adding to the issue. But even if
yeah,
they're not legally allowed to hold it against you or their policies state something different, I still, managers are people and your coworkers are people, and you need to really evaluate the situation before you share. I say, as I host a podcast where I talk about every little thing that has ever happened to me about this. So, caveat to that is I don't follow my own guidelines. I'm here exposing everything about everything. But that being said, going back to your journey. So, the way I see it, you have a full-time job and then another full-time job raising a child, and then another part to full-time job just managing your own care. That's quite a balancing.
yeah. It is, and I can't do it by myself. I have to have good friends and family. I mean, I have had to learn how to delegate, and in my professional life and my personal life first. Um, and
So, I mean, you could really put this on a resume as learning to manage a team. And,
yep,
there's some other business ways to sell it, but it does sound like you are really processing. It does sound like you're really managing a team at the end of the day to make sure you get your care and get your life in order and
yeah,
keep it in order.
yeah. I mean, anytime I have an appointment or something, I'm like, okay, I have to get this in line with work. And then I have to be like, all right, well, who can pick up Charlie, from school? And then it's like, all right, well, is this appointment going to change any of my medications? And then now I have to get, like, let's say I have to go see like a psychiatrist for something dealing with my evaluation. Then I have to work with my insurance and get that going, and then work with my primary care provider. And, I have blood testing that my cardiologist in Boston orders, and I live in Virginia.
A
Yeah,
lot of travel.
it's a lot of travel. It's a lot of travel. But, I mean, I think that Boston's the best in the world, so I will travel. And I love traveling up. I drive to Boston all the time. I love traveling up the uh, eastern seaboard. It's just beautiful. But yeah, I mean, I have to navigate, like what you said, professional, personal, children, all this kind of stuff. Yeah, school. I mean, my diet. I mean, oh my gosh, I have a strict heart healthy diet. I mean, I have fluid overload issues. Sodium is this, that, sugars are that. And it's like, that is just, can consume someone's life, just your diet.
Very easily. Very easily.
And so that's just one part of my 10 things every day. But
And that really leads into this next set of questions, which is going to be, what is next for you with everything we've discussed? And, that's short term. In the long term, how do you envision your life, post-transplant? If there is post-transplant, is there still a chance you'll never need one? Like, what's the outlook from here?
So, I've consulted with 3 hospitals, Boston, my team included. Transplant is the goal, the ultimate goal. I just don't have any options. So right now we are talking about the implantable cardiac defibrillator. And then we're talking about Entresto as well. And, my personal situation right now is Entresto might not be good for, I actually found something very interesting about Entresto. That is usually, they give all heart failure patients, but they found congenital heart patients don't really do good on it. It's more of the acquired heart disease patients that do better on it. And so that's something, that's kind of nerve wracking because it's like, oh, well, that's a part of the plan, but that might not work for congenital patients. And another thing that I actually would like to include, not a fun fact, just a fact, the 1%, podcast. Being a transplant patient, a congenital transplant patient, you're also in the 1% of transplants. So, yeah. So it's only 1% of transplants per year are congenital patients. So it's, I'm just, it's overwhelming sometimes to think about, what's next.
What comes next? Yeah.
Yeah. Cause, I have an MRI, I have a VO2 stress test, and then I have a abdominal ultrasound, I have a CT, and then we'll get all that. And then we'll see what the next is. And, they do it by these like little rounds of testing to see what next testing you need. Or, oh, do we have everything? And so it's like, okay.
Because the results of one set of tests is going to determine what the next step is.
Yeah.
Almost a decision tree where it's if it pops up, something pops up here, then you take this path.
Yeah.
So you really don't know how long, what the time frame is before that eventual transplant.
Yeah, I don't do, what I do know is that my situation, they're going to list me preemptively because right-sided heart failure patients tend to acutely get worse, like just like that. And so,
so it can progress quickly out of nowhere.
Yeah. And that's been usually what has happened to me in the past. I've had a valve transplant when I was 27 from the one when I was 15. And that was an emergency room visit. Then I came out with a new valve. And so it happens very acutely. And I'm young. And that's kind of what they're afraid of, is that, let's not mess with Bailey. Let's, preemptively do this stuff. And so it's like, let's say it's 3 years from now and I've been listed on UNOS outside as 3 or 4. And I'm like hiking in Italy because that's what I'm going to be doing in 3 years. And let's say something happens. And so an Italian doctor, all they need is just Wi-Fi to get into UNOS to see all my medical information. And so that is a barrier there of protection as well. And so it's like, being put on the list is kind of terrifying because it does mean that you are, your heart's sick. But it also, to me at least, it kind of makes me feel good that, I can be living my life.
And you're ready for whatever comes next.
Yeah, exactly. And that's how everyone's posed it to me. And I agree. I like to be prepared.
I feel you there. I always like to belt and suspenders, double prepared, everything ready to go. But, all this being said, I always like to look for the silver linings. So what is one thing you've learned about yourself, or it could be a few, that you never would have discovered if not for this unfortunate journey?
I would have not known how tough I am. I mean, I am just amazed at myself. I actually, when I was 15, I had my open heart surgery. I was only on Tylenol. I didn't take any pain medication past, to pick you. And I would have never thought that, I'd be working for the company that I do and have the job that I do. And I just didn't realize how motivated I am to be better and to feel better because of this. And, I've learned how to take care of myself very well because of this heart disease. And that's what I want, for every portion of my life, including my professional life. And so it's making me ask more questions. It's making me want to be more prepared about not just, like in seeking a job. Can they give me just professional, things, or can they really help outside of, work too? I've got things going on. And so, I've just become just more aware and more motivated. And
Yeah.
I wouldn't trade this for the world, honestly. I'm thankful for him.
And it's amazing. I think in every episode I've heard something along the lines of resilience, determination, knowing myself, and, happy or proud to be a CHD patient. But something you touched on there that also is a great takeaway that I don't think we've put together before is it makes you a better employee. I mean, a lot of what you said was about growth and, time management. And in a lot of ways, dealing with something this severe in your own life makes you a better professional, and it makes you better, personal life aside from this event. You're better at managing your time because you know how valuable it is, and you want to spend time with your kid. You're going to make sure that happens.
Yeah. Oh yeah.
So it's yet another silver lining that we're all going through this together, and we're all really finding our way. But there's a lot of good that comes out of something so bad, and I'm always happy to hear that.
Yeah. I never thought that I would be able to have children, and I have a 3-year-old. I've constantly defied doctors' odds, and that is an accomplishment in itself, and I'm proud of that always.
And you should be,
Yeah.
But this all ties to my big culminating question. We've covered a lot, and something I ask every guest, and I'm sure you're ready for this one, is what does CHD now mean to you? Not the malformations in the structure of the heart, but given everything you've personally seen, when you hear someone say CHD, what does it mean, and how do you feel?
The first thing that comes to my mind is just being a warrior, because you're literally fighting for your life every day. You can't, this is for all chronic illness, but especially with your heart, it controls everything in your body. And so anyways, it just means, you have a warrior mindset, and, I will do anything and everything every day to get better. And, I'm proud, and that's what it means to me when I hear that. Just, being a warrior, and, just fighting hard. And some of the, you touched on, meeting other people and being able to talk to other people. And, I'm so thankful that you started this podcast too, because, we wouldn't have been able to meet. And, I think it's just so fun to meet other warriors too. So it just means so much to me. I can't put it into, I could go on and on.
It's the fact that we're all fighting our own battles, but we're doing it together. Because in a way, I've seen people that have gone through what I'm going through now, and I can look at them as the guidebook, the goalpost of where I want to be and how to get there, and avoid the common issues that might have come up. If like you said, they took too long to test for certain things with you. But now when you're talking to other patients starting their journey, you can say, hey, make sure they test for this out the gate, or make sure they're watching this. Make sure you find a doctor. Here's the doctor I go to. It's giving that guidance to the next generation. And as that builds up, it's only going to get easier, because the person you help is going to have their own little tricks, and the person they help is going to have theirs, and eventually it just builds and builds. And that's the point of a community. That's the point of the CHD community.
Yeah, absolutely. You may be going through something that your doctors have found that works excellent for you. And when you start talking to someone, oh my gosh, yeah, I'm having that same issue. What worked for you, or what's working for you? And, I love that about this community too, is, when we start talking, we can help each other. And that's what, we're in it for, is to help each other figure this out, because we don't know a lot about it right now.
Right. And that's really the point of this podcast, but also all the CHD communities, and really every community. It's a group of people helping each other. And the more we can do that, the better off we're all going to be. And that was Bailey Vincent, a CHD patient navigating the healthcare system and transplant process. Thank you all for listening to us today. And remember, if you have any questions, you can reach out through the website, 1percentheart.com. You can email support@1percentheart.com or message us on Instagram @the CHD podcast. Talk to you soon.